First of all, I'll tell you my story briefly. You up for that?
Yeah.
Absolutely. Yeah. So I was a psychiatric nurse when I was 18. Did that for 3 years. Then I was a general nurse. Then I worked abroad and did quite a few different jobs. Worked on theatres, worked in refugee camps. Then I started going into academia. So I did something called a diploma in nursing, which was really hard in those days. Then I did a degree and a master's degree and a PhD and became an academic and became a researcher. But my main job really was teaching. So I taught student nurses. A few medical students would drift in, a few physio students would drift in. No, it was healthcare education. And that had to be evidence-based. Now, you could go back and look at the primary source evidence, and we did to a degree. But that's not really what would stand up if there was any serious question marks. What would stand up is, what do the guidelines say? So, for example, I taught care of anaphylaxis. That was one of the things that I taught as part of intravenous therapy. I started teaching intravenous therapy to non-doctors. And the British Resuscitation Council would update the guidelines from time to time, and you had to make sure you would teach exactly what was in those guidelines. And most times it made sense. Resuscitation was another one. Every few years, the Resuscitation Council would change the guidelines based on expert opinion. All seemed to make sense. Teach the latest guidelines, get better outcomes. It all seemed to work. And that's what my entire career was predicated on. While we did some primary research, basically what we taught was based on the guidelines, the current guidelines. And then when I retired from academia, working in A&E, again, everything was guideline based. So a new patient would come in and the consultant would say, let me think about that. No, that didn't happen. They'd say, go and look up the protocol for this. And it's on your computer, the National Institute for Health and Care Excellence, which I've always thought is a rather Eastern European title because it's got excellence in the title. You know, anything with democratic or excellent in the title is probably not democratic, probably not excellent, but passing that by. And we would follow that really quite meticulously, quite religiously, really. Because if you didn't and something went wrong, the first question would be, did you follow the guidelines? Mm-hmm. And if you say, no, I know better than the guidelines, oh really? You had to follow the guidelines. So when COVID came along, I still had this deference to authority. And I followed the guidelines. Looking back, I was wrong. No two ways about it. And more evidence came along. And if I have any saving grace at all, it's that I tried to follow the evidence. C.S. Lewis, follow the evidence wherever it leads. And it could lead to a really horrible place. And in some sense, it does lead to a horrible place, but you follow it because that's the nature of reality.
And was it gradual for you, John?
Well, what happened, so basically throughout 2020, I accepted the narrative. And then 2021, question marks started coming more.
Because you had your dog with the mask on and everything in the background, didn't you?
Well, I believed what we were told.
Yeah.
I got that wrong. Mm-hmm. I believed the narrative. I'd done what I'd done for the past 45-year career and followed guidelines, which, to be fair, had served pretty well up till that point. Mm-hmm. So, the guidelines on antibiotic therapy, on sepsis, they all made sense, and I could see them at work saving people's lives. There was a rationale to it, and it all kind of made sense. So when the odd things started coming up that didn't quite make sense, you'd hear a death from a vaccine, and you think, well, this happens. I've seen people die from paracetamol, not from ibuprofen. We've treated it, but I've seen people who would have died from ibuprofen without treating it. Unfortunately, happened. So at first, I still accepted the narrative, but then the evidence accumulated. And what was the main thing in my mind was people talking about vaccine injuries. And I started talking to people about the vaccine injuries they'd had, and I realised these weren't isolated cases. And that's kind of what started the questioning. And that developed from there over really a 6-month period, really, from maybe the end of 2021 to the beginning of 2022, realising that this is actually a house of cards, a lot of this. Then they came to realise how much financial investment people had, how much control investment people had, and how that was affecting, how was that, some might say, dictating the narrative. So having believed that my superiors were working on science, which I think, to be fair, they had done for a lot of my life, I was in this horrible situation where I realised they hadn't. Now, looking back, even the science I followed for my entire career was somewhat biased, because that's based on what's in British National Formulary. That's based on what's in the NICE guidelines. And I thought that was based on evidence. But actually, where does that evidence come from? Well, very often that evidence comes from people that have paid for that evidence to be collected.
Exactly.
So I took it back a stage further. And the other thing that really brought it home to me like a ton of bricks was the repurposed drugs.
Mm-hmm.
I talked to doctors around the world who were saving lives with these drugs. They were branded as horse medicine, horse paste, and other drugs. And I realised that these doctors I was talking to were really experienced, clever clinicians. And when they told me something was working, you can't ignore that. And yet people were saying, this is rubbish.
I had a moment watching the Dark Horse podcast that Brett Weinstein hosted with Steve Kirsch and Robert Malone.
Yeah.
It's like 3 hours worth of stuff. And I found it jaw-dropping because, Steve Kirsch talked about ivermectin and he talked about repurposing. That was what he was in the business of. He was in the business of, whenever something happened, they would say, well, what have we already got? Yep. Does it also work for this? Let's do this kind of thing.
Yeah.
And then when I realised that it took like no time at all to look up ivermectin and find out all about ivermectin, which was that it was this wonder drug that had been, Nobel
Prize 2015.
And it was a wonder drug, and it was in such and such a health organisation's absolute toolkit that you've got to have. Make sure you've got ivermectin wherever you're going, because it'll definitely do no harm, and blah 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 blah. And I thought, and yet obviously Joe Rogan, who had taken it, was being ripped apart because everyone and anyone was saying, "Oh, Joe Rogan takes horse tranquilizer."
Ferociously attacked.
Horse. And you thought, but if you just Google it, it tells you all this stuff about how it's been given billions of times, and it's for river blindness, but it's also an anti-inflammatory. Blah blah blah. And I thought that was clearly there's got to be something. There's something badly adrift here. But why? And you got castigated because you had been, as what you've just said. But I found your story amongst the most affecting because you changed course.
Yeah. You changed.
You could have doubled down. You could have just stepped away from it. You could have just, turned off the lights. But you didn't. In the face of everything you had said, you then started saying, "Hang on, So I thought, while you were being ripped into by some for that change, I thought, no, wait a minute, that's.
Yeah, I've seen people put videos up of you back in 2020 and criticise you for saying, but he was saying to take it or whatever.
But the thing is, the whole point. The whole point was that John thought that and honestly said it because he thought it, and then he's read enough and talked to people and he's changed 180 degrees on some of this stuff, and now he's saying that. I thought that's what you want.
And look, there's a book called The Illusion of Evidence-Based Medicine, which I'd highly recommend reading, and that explains how this whole illusion manifests really from what you were saying earlier about clinical trials. And actually, if you're a body assessing the evidence, the actual evidence on the table to assess who puts that there, that's the critical thing. Because if you're not looking at the right if you're not creating the right studies in the first place, you're going to get a very biased view of what is working and what isn't going to work. But not just that. A lot of these studies only look at short-term outcomes. They don't look at the big picture. It's going back to what I was saying about zooming in and just seeing a narrow slit of the problem without stepping back and actually saying, yes, but what's the long-term effect of this drug? A lot of the time, it's not properly examined.
In a sense, Sackett anticipated this. The father of evidence-based medicine, didn't he? He talked about the three-legged stool. So he had what the evidence said. And that's the one we're having the problem with now, because the evidence is what vested interest wants to give us and other evidence is ignored. But he also talked about expert opinion, the gut feeling of the doctor, which basically has been ignored. And he also talked about patient preferences, which has basically been ignored. So two legs of the stool are basically ignored. What the patients want is largely ignored. The doctor's gut feelings, well, doctors aren't allowed gut feelings anymore. They've got to follow the protocol. But the protocol is based on this evidence, but the evidence is highly selective. Evidence of things which are absolutely brilliant could be suppressed. The research is not done. The research is not commissioned. But the research which got a particular outcome that's desired is paid for, gets to the table and is authorised. And that's before you even start talking about revolving doors and people going from regulators to industry and from industry to regulators. And the more I've learnt about this, the more uncomfortable I've become. And the more, like you, Tim, I think we're working under an illusion of evidence-based medicine.
Yeah.